CRISP was formed in 2001 by a group of organizations that wanted to work together to promote intersection traffic safety in the capital region. We're comprised of the Alberta Motor Association, Alberta Health Services, Edmonton Police Service, St. Albert RCMP, Strathcona RCMP, the City of St. Albert, Strathcona County, the City of Edmonton as well. And most of our partners are represented here today at this event. So we focus on intersection-related safety by targeting red light violations, pedestrian safety, speed, and high crash locations. We collaborate and integrate our traffic safety efforts through education, engineering, enforcement, and these strategies we hope will give us the best possible impact. One of the struggles we always have is defining the scope of the issue of traffic collisions. To simply say that there are about 40 collision-related deaths every year in our region doesn't begin to tell the whole story. And these numbers don't always resonate with the public and policymakers. We need to understand how these numbers affect us. One way to measure this is by calculating costs. How are we all affected economically by collisions and the resulting deaths, injuries, and property damage? So in other words, what is the bottom line? CRISP commissioned a study to determine average and total costs of collisions involving fatalities, injuries, and property damage. This included Devon, Edmonton, Fort Saskatchewan, Leduc, Sherwood Park, Spruce Grove, St. Albert, and Stony Plain. We have known for a long time that collisions carry a hefty price tag. But what we didn't know is that the price tag is nearly $1 billion in direct costs every year. The study found each fatal collision costs more than $180,000. An injury collision costs almost $40,000. And the average collision that only involves property damage costs approximately $11,000. In 2007, there were 43 fatal collisions with 44 fatalities, 8,517 injury collisions, and 51,822 property damage collisions. These collision costs total over $900 million. And while $900 million every year is a staggering figure, we believe it's only the tip of the iceberg. That total reflects direct costs like property damage, health services, legal costs, and lost productivity. But collision costs us more than a trip to the body shop or a ride in an ambulance. We also pay indirect costs in the form of grief, pain, and suffering. These costs are paid by people close to the person involved in the collision and by society as a whole. Our study estimates that indirect costs total at least as much as direct costs. We used a willingness to pay model to measure the value people put on their own lives and on the lives of people close to them. The study found that people in the capital region are willing to pay $5.3 million to prevent a death in a collision and $95,000 to prevent an injury in a collision. We have included a detailed summary of the study findings in the packages we've distributed to you, and I encourage you to take a look at some of the other findings. But these are more than just interesting statistics. Knowing these costs helps us to communicate why traffic safety is so important when we are talking with policymakers, our partners, our sponsors, and the public. And they're more than just numbers. These are people and their families. Paul Brodeur wrote in his book, Outrageous Misconduct, that statistics are human beings with the tears wiped off. For every number we write in a news release or information sheet, there are dozens of people affected. Today, we'll hear just some of the professionals and groups that are affected by collisions. So when we were organizing this event, we really wanted to include someone who had been injured in a collision, who would tell their story and how that injury affected them. It sounded easy since there were so many crashes annually, and we've been in touch with many people over the years about their experience. But no one was willing to tell their story publicly at an event like this. We were stunned that people were so hesitant. It turned out that people feel there's so much stigma around crashes and injuries. They worried that people would blame them for getting in the crash in the first place, or that they'd be judged for suffering a brain injury decades ago. How would that look to the parents or teachers at their schools or their children? It's clear that collisions cause deeper and longer lasting wounds than broken bones.